And thank you everyone for staying here. I hope you had your own coffee, so you're away from NASH. Okay, you should have 2 to 3 cups of coffee every day, so that will keep you healthy and away from doctor. And today we're going to talk a little bit about the clinical aspects of substance use. I need to apologize that mental health itself is a very huge domain, and also working with young populations are also another very specific domain. So I will just focus on how to evaluate clinically people who might use substance in your clinic. So let's start with our first case, Mr. K. So Mr. K is a 24-year-old man who have sex with men. He's single and he's an office worker. And just like your regular PrEP clients, he came to your clinic for PrEP. He has been diagnosed with gonorrhea urethritis 2 years ago at the age of 22. And he received an intramuscular ceftriaxone injection, so he had been treated completely. And when you ask about his sexual behavior, he said like his last contactless anal intercourse was 2 weeks ago while traveling to Taipei. And actually, he went to Taipei with his friends and he didn't use PrEP before. But at that time, his friends there gave him PrEP, and it must be probably from their friends. So he took on-demand PrEP or 211 event-driven PrEP given by his friends at that time, and he probably didn't receive any HIV screening at that time. So you must be wondering why traveling to Taipei has something to do with PrEP. Well, actually, there's a lot of parties going on in Taipei. So it's just 2 weeks ago, it was New Year's, so there's a party going on there. And asking about his regular condom use, he will say that's 3 to 4 times out of 10 times of anal intercourse. So it's less than half the time that he was using condom during anal sex. So we did perform the rapid antigen antibody combo test, and it showed negative. So we'll keep on asking about his trip to Taipei, which seemed to be fun. He actually mentioned that he did use some recreational drug in Taipei. So this workshop is supposed to be pretty interactive, so we'll start with the voting. And also, if you have any questions, so please just stop me and raise your hands. We would love to give a more discussion. So what questions would you like to ask your client? Would you ask what recreational drugs do you take? How do you take it or take them? Will you ask, did you enjoy it or enjoy them? Did you experience any discomfort from it or them? Or was this the first time taking drugs? If not, how often do you take it or take them? And do you take it and have sex? If so, do you use any kind of protection such as condom or PrEP or other questions? Please vote using Slido. I mean, this is multiple choices, so you're very welcome to ask as many questions as you would like. Oh, sorry. All right, so far we have 30 people, 31 responses from the audience. So I think most of the people here are really ID physicians, and all we cared about is sex. So besides drugs, we are really about how risky they are. So I think the number one question people would like to ask is, do you use condom or PrEP or any kinds of protection during sex. I think it's quite important because as we learned from this morning that recreational drugs can be used with or without sex. Maybe he was using MDMA and there was a big party and he didn't really have sex. But if he was like engaging in crystal meth or GHB, GBL, then that will be probably something associated with sex. And the second question, like the top is second question that people would like ask is, what recreational drugs do you take and how do you take it? This is also a very important question because we need to identify what kind of substance people are using. Then we could go on for specific harm reduction contents. So if they are using crystal meth, you can keep on asking whether they were using like smoking or they were actually injecting or slamming. And then the third question, third most question that people would like to ask is, was that the first time taking drugs? If not, how often do you take it or take them? This is a very kind of tricky question, but I like to really brought up in my clinics because sometimes people just start using this because of peer pressure and this is just a trial. And very likely they don't really like it. And this is the first time and they feel weird about it. They kind of being shocked by the side effects of the drug. So it's kind of interesting to ask our clients like whether this is really the first time they had it. And if not, if that's a frequent use, how often do you want to, do they use it? The fourth question would be, do you experience any discomfort? And also the last question will be, do you enjoy them? I was a little bit sad to see people are reluctant, but I really think that is probably the case, that people are reluctant to ask whether our client enjoy using drug or not. I think for most of us, we think that it's not ethical to ask this question, that our clients should not or should never enjoy the substance they use because it's not healthy. But I think it's also very important that by establishing a rapport with our clients, we have to know why they want to use it. A lot of time they really enjoy it, and they enjoy it, so that's the way that we can keep the conversation with them. So I would say, like, if you are asking this question, don't use a sad face, like, do you enjoy it? No, we have to use it with a smile, like, oh, do you enjoy it? How do you enjoy it? Like, oh, do you feel like you have more desire or the sex itself become even better? So I think you have to balance the pros and cons, especially like the discomfort they experience and the enjoyment they have with them, so they feel like you are really thinking for them. So thank you for your response. It's quite nice. And I see there are 20% of people who actually would like other questions. Will somebody in the audience would like to share, like what else question would you like to ask? Where did you get it? Sorry, please do. Yes.
Hello. Considering all the questions asked and his answers, would he consider using it again?
Oh, yes. Yeah, that would be also the question, like, did you use it for the first time? And how often do you use it? And would you use it again? So we are all want to frame the picture that at which part of drug using trajectory this client is. Sorry. So we didn't talk much about these slides this morning because it's really some details that has been put out during my practice in daily lives. So a lot of time we are a little bit shy from asking questions directly. So a lot of time you are asking your clients like, did you use something? Are you using something illegal? Is that okay to use that? So a lot of time we are actually not using a very neutral word. Instead, we are having our judgment already. So this is a skill of talking about or bring up the drug history that you can use quite non-judging attitude and avoid words like illegal or drug abuse. So sometimes we use recreational drug, so that sounds actually more neutral. And as we said, like it's not all about drugs, it's about sex itself. So we didn't hear the question from the audience that sometimes you can ask like, with whom you had the drug with? You had a drug with your own partner, or you had a drug with other casual partner, or the people that just met on the internet or during the party. Because if the drug is involved in a partnership, it sometimes becomes very tricky, because you're not only addressing the drug issue, you're also addressing a partner issue, a partnership. And sometimes drug may not be the core issue, it's the partner that has the problems. And also when we do the history taking, we have to ensure that privacy and confidentiality for the clients. I was giving this like similar talk in Singapore, and it was very surprising to know that in Singapore, if you know that your clients are using drugs which are not legal, you have the obligation to report it. So for a lot of countries in Asia that you do have some legal consequence, even for healthcare providers, that you are obliged to report if people are doing drugs. So like in Taiwan, we are pretty lucky that we don't have to do that. So you can always do whatever you do like as a medical professional, that you can write it down, but we have no obligation to do that. So I think this is also something that we should advocate for, especially in our region, that when drug comes with medical issues, that these should be treated, or these should be seen like separately from a judiciary system. And also sometimes when people are talking about using drugs, they are talking about having same-sex sex. So in some countries, that will be also cause some problem as well. And don't forget to smile, really. Like a lot of time, it's stressful for our client to mention this experience. So if they're seeing you not very happy, they were probably not going to tell you next time. But about the details you ask is like the frequency, the dose is the root of the substances, and how about, and also the polydrug use. A lot of times, as you can see from Dr. Guadamu's research, that the #1 drug use here would be crystal meth. But very frequently, people also use GHB, GBL, or other anxiolytic. So these polydrugs will actually have higher likelihood to cause harm or even overdose. And people might experience more physiological problem with that. So knowing the polydrug use is kind of important. And also you might want to focus on the drug-drug interaction, especially if they are taking certain kind of drugs. And other details include sexual experience and overdose experience, and how did they ever do something with that. So the overdose experience is the way that how we assess. For example, if you're using GHB, GBL, the overdose would be lost consciousness during sex, or they were having a blackout. So if people are having a blackout, like you drink too much alcohol, for example, this is overdose. This is not normal. You shouldn't sleep during sex. If you are really fall asleep during sex, that means you are using too much GHB, GBL. And also if you are overhearing voices, and you are feeling being persecuted, you are worried about someone is like doing bad thing to you during the party, then that's a very typical of paranoia and also auditory hallucination. So this is also a sign of hallucination that you should tell your clients that they are being using that they have been using too much or using that too quickly. And so after getting all these ideas, then we can go to the three cycles that I like to put. It's like we can determine at which phase our clients are. Are they in an entry phase, or they are like having a constant use, or they're actually thinking of quit? So the entry phase, I think it's very important that we should let our clients not use more or going further. So a lot of time I'm discussing the potential harm with them, and also knowing whether they really like it or they just tried it for the first time and they actually don't like it. So for crystal meth or even slamming, a lot of people were scared about the idea. So even they slam for the first time, they may not want to slam the second time or third time. Yes, please.
You mentioned it earlier this morning, and I'm sorry,
Sure.
cutting in and asking a question. No, but help the old white guy here. What is slamming?
Oh, sorry. So slamming is a colloquial way to say injection drug use. So slam crystal meth or inject crystal meth intravenously. Yeah, so that's called slam, sorry. So basically, from our study, we know that people who do slamming had an additional injury, and also people are more prone to have addiction compared to smoking. So if people are really at the entry level, we can start the harm reduction strategy already, and also if people are decided to keep using that, maybe they can try to stay at where they are. For example, if they are smoking crystal meth, then probably not go further to slamming or injection. And then there are people who are at the use phase. They are pretty okay with that. They may already have some problems, and they may have the problematic use as we mentioned before, but they are not aware of that. They think that if they are not using crystal meth every day, it's not an addiction. So at that time, every time they came to our clinic, like we need to talk about their issues. It's not just asking to quit, because if people don't have motivation, if they are not have self-motivation, they're not going to do that persistently. So every time there will be a chance that to talk about their drug issues, and also using a spurt. That's a screening and brief intervention. And brief intervention includes all the talk that we just mentioned, that the side effect they might experience, and if they have really experienced any problem in their life. And when they are ready to be referred to the psychiatrist, sometimes it has to be patience. So once they decided to do that, then we'll be safely and they'll be willing to be transferred or to refer to our psychiatrist colleagues for more help. And then once they exit from the drug use, keeping them sober while having sober sex would be very important, and to prevent relapse will be also one of our main goals by, for example, joining more NGOs and also more supportive from the therapists, for example. So these picture was shown like many times today. A lot of times people in the clinic feel like we can do so little to our clients. But in fact, there are so many stuff to do in our clinic. There are all the details that you can talk about with your clients, like telling them about the side effect of the drug, and also talking about how to avoid overdose would be life-saving. For example, a lot of time people were using GHB, GBL without measuring the substance correctly. So they may get overdose. So you can advise them using, for example, droppers, or not using cap, but droppers to measure the exact amount they're going to use each event. And also you can tell them about not using too much or not chasing too quickly. For example, within one hour. You should wait for 1 to 2 hours and wait until all the effect comes up. And then if you want to use more, then you can just add the dose slowly and little by little. So these are all the details that you can talk about, because all these are actually life-saving. All right, so let's go to the second case. So the second case is a Mr. C. It's also a quite typical case that you will encounter in your clinic every day. This is a 29-year-old MSM. He recently returned to single, so he had a relationship before, and he's jobless. He's jobless not because he is not working, because he doesn't have to work. He was born in a very rich family, and his parents were pretty nice to him, so he actually had money and he doesn't have to work. I'm quite jealous about that. But he has been diagnosed with AIDS 3 years ago, initially with disseminated MAC infection and CMV retinitis. So the initial CD4 was pretty low with a very high viral load. So he started treatment with Triamac soon after diagnosis, and then simplified to dual therapy Dovato after 2 years, and remained virologically suppressed since. So the 2 times before he visited me, the viral load was undetectable. Then the CD4 was 309. But for the last visit, he actually delayed 2 weeks to present at my clinic, and he actually said he missed 1 week of ART. So we checked the viral load. There's a small blip, 32 copies per milliliter. And also, when he visited our clinic, we do all the screening tests, and there was newly diagnosed syphilis. And he looks actually not as good as he used to be. He had a body weight loss for 5 kilos. So as me, I always feel like if people are losing too much weight, so I was asking, are you using Ozempic, or are you actually on any of the recreational drugs? So like we usually, because a lot of time people are they are going to the gym and they are trying to lose weight. So I would ask them, oh, so there's a kind of body weight loss here. Did you lose it on purpose, or it's not something that you expected? And if there's a not like my colleagues, they are worried about people gaining too much weight. Personally, I feel like if my clients is losing too much weight, I feel more worried. So if people are losing too much weight, then I will always ask oh, did you use crystal meth, and how do you use it? And so this client actually confessed he actually had a crystal meth use before, but after he broke up, he resuming using it and also with slamming recently. So time for the questions. Again. Okay, so the most frequently asked question would be, how often do you use it? I think for a lot of times that we just mentioned, our clients think they don't have a problem because they didn't slam drug every day. They are not addicts, they think. They don't use drug every day, so it's okay. But to be honest, we will show you the data earlier this morning that if they've been using substance, especially crystal meth, once every month, that's actually problematic already. So that's a very vital question to ask, and somehow it points out if your clients are having a problem or not. And then the second most asked question would be, do you use new needle syringe every time? I think this is a very important question, and the question comes after that is, where do you get that? Sometimes even for myself, it's a little bit difficult for me to pop up this question as if I have the obligation to provide it. But to be honest, we do. So a lot of time they are buying that from the pharmacy, and if they don't have it, then we need to direct him to the traditional drug services, like they're providing clean needle access. But also in our region, there are countries that clean needles are not available. So this is also something we need to think about while we are doing harm reduction for our community. The third question would be, have you slept or eaten well recently? I like this question a lot because this is a very fundamental question, and this is something that's very caring and that shows your empathy to our clients. So if you have no other question and don't know how to ask, just ask them, did you eat well? Did you sleep well? Because this is really the least thing that we might probably can help them. Especially a lot of time they were having crystal meth and they cannot sleep very well. So prescribing some sleeping pill will probably start a good rapport with them and letting them know that you're very willing to help them. The fourth question people will ask is like, did you miss your medication or meeting your friends and family recently? This question is also very important because we are talking about a social function. That if our clients have already not been affected physiologically or mentally, but they are also having some social dysfunction. That they cannot carry their regular social life, or they become withdrawn from social interactions. They are missing their appointment at work, or they're missing their meetings with important family members. So these are really indicators for you that people are really having a problem and they are kind of needs more help. And the final question that people would like to ask is that, do you slam by yourself or did someone else help you? A lot of time, there were, we call little nurses in the party that they were helping people to slam, and they actually charge them. So it's important to know that whether people know how to slam, and I mean, in some facilities that you are allowed to actually teach people how to do self-injection without punching the needle in them. So there will be some materials available so we can show that what is a safe injection, how to protect your veins after slamming. So one of the tool that we're being talked about today is SDS, or Severity of Dependence Scale. It's a very nice tool for all kinds of substances. So for all kinds of substances, you can use the same scale to evaluate. Although the cutoff value for problematic use differ from substance to substance. And the question sometimes I ask myself as well, if I drink too much alcohol, I was like asking myself, do you think using alcohol was out of control? Did you think the perspective of missing a fix, like drinking alcohol, if they make you anxious or worried? Do you worry about your use of alcohol? Did you wish you could stop alcohol? No. But how difficult do you find it to stop or go without alcohol? Quite often. So you can ask every substance about it. So for crystal meth, the cutoff value, as we mentioned this morning, would be actually 4. So any of the point greater than 5 would be something significant. And then as we said, when we address the social harm, they are not just, for example, missing appointment. They can be spending more time with drugs and sex. They can be absence from work or appearing high at work or spending more money for drugs, etc. And when people are having in the trajectory for really long enough, I don't have time, but we'll finish that very soon. If they're on this journey for really, really long, then probably started to encounter legal harms. For example, they'll be caught by police, they're being persecuted, or they're being phishing on the internet. So these are all like signs that you know that people need extra help. We didn't mention much about other tools evaluating other mental issues, but there are two tools that people usually use. One is a patient health questionnaire, or PHQ-9 for depression. Another would be GAD-7 for general anxiety disorder, for anxiety evaluation. The thing is that these two are quite frequently used, but they are not so sensitive, I would say. A lot of time from our study, we realized that most of our clients didn't report any risk in terms of GAD-7 or PHQ-9. So they usually fall on like a low risk or mild risk, not really fall on moderate risk. But it's kind of important to bear in mind that while people are using substance, they might present all these symptoms in this questionnaire, they might actually have some depression issue. So our psychiatrists will actually add more antidepressant or other drugs in order to be as part of the treatment for their substance problem. So that's pretty much my talk today, so thank you.